unoccupied bed. Yeah, get a hamper. Now, what I show you now, you may not see for real, completely done in a clinical setting. You need to have your poker faces on. Okay? While you are doing bed making, unoccupied bed, avoid putting your linen, even if it's dirty linen, on the floor. That's what your book tells you to do, but you don't always see that in the real world because that's one of the least things you are actually maybe concerned about. Okay, the dirty linen. Come. I'm gonna put this to the side, the pillow. There's different ways that you can actually do your unoccupied bed, but for me, what I do is do one side first. And remember, we get into the habit of turning away. If I notice that the mattress itself is soiled, this is a good time for me to now clean that mattress, wipe it down with the purple wipes. Usually it's the purple wipes, or if there's the orange wipes that I know of. Is there
I think bleach.
Bleach, oh, yeah. Okay. Clean it down, let it dry, air dry, and then you put your linen. Okay, I have my fitted sheet. And you're going to see different methods being done. All right, I put my fitted sheet, my chucks, it's going to be next. Yeah, you can put it. Chucks is going to be green down in the middle of the bed. If the patient does not need chucks, avoid it as much as possible. The minimum amount of sheet that is laying underneath the patient, the better. Why? What were you saying?
The folds increases cost.
Yes, it can potentially lead to skin breakdown. You may want to have to talk to your assistants. I'm going to put for our patients who are incontinent.
We got like 4 packs. I don't.
Yeah, like they be packing the patient up. No. All right, do not do that.
I see some people put the drop sheet under the chucks, and some people put it on top.
Yeah, you mean this? They create a drop sheet underneath. Yes, that's fine, but again, that's a lot of linen that you want to avoid. But as long as the patient is ambulatory and not so immobile, it should be okay because they can move.
Yeah.
So what happens if the patient is immobile? Like if they really cannot move on their own?
Next reposition every 2 hours.
Please make sure that you do that and not just document move the patient 2 hours, every 2 hours, but actually do it. Be the good nurse.
Right, so what I want to do is to make sure that it's actually even, and I want to avoid and make sure that there's no mountain highs, valley lows. Okay, that's the best I got. Mountain highs. Make sure it's straight as much as possible. Because like Nurse Tim said, all those curvatures in the bed can cause skin breakdown. Now I'm trying to make sure it is even. I'm making sure that my linen is not on the floor. And the best time to usually do bed changes is when the patient is out of the bed. I think that's good. Is it too much on the other side or? It's good?
Yeah, I think
Alright. Now, for check-off purposes, I have to show you the miter. Do we care about the miter? Do you? You care?
I'm an ER nurse, I don't care.
Okay.
Is there blood anywhere? No.
Yeah, right? But we don't really care about the miter. The old school nurses or your old school instructors will.
Who's into that are the CNAs. They're
Really into yes.
Yeah.
Okay. You do the miter, I'm glad?
Sometimes.
Sometimes. She said sometimes.
Sometimes
Okay?
I have time to do that.
In reality, you're not gonna, depending on the type of unit that you're in, you may not always have time. But just so you know what the miter is, you see?
Yeah.
Huh? Yeah. Hospital corners is another name, yeah. All right, boom. Take it at an angle. You see? create like a little tent, bring it over, and bring this underneath, and that's it. Boom. CNAs, when they have time, they be all fancy with the decorations of the top, you know what I'm saying? Have a little fan thing going on, like you in a 5-star hotel. Sometimes, but so the main thing that I'm looking for, if you do just one fold, I'm fine with that. Okay, because one fold, 2 folds, 3 folds is not going to save or jeopardize their well-being. Now, the main thing again that I'm looking for, I'm trying to avoid these hills and valleys. So to do that, you gotta stretch the linen, the draw sheet. In the hospital setting, they really fit much better. Am I
That's a
good?
very good bed.
I've never had that bed.
When I do it, this is good. I never folded it this way.
That's that. Oh, and then the pillows. Again, some of my senior nurses, you know, they get very picky on how you remove the pillow and place the pillow. Just do it. With me, just do it. Okay? Now, this is a dirty pillowcase. I'm not gonna put my dirty pillow on my clean bed. Okay, so you're gonna avoid that. The other thing too, well, simple thing. And of course, remember you're doing this with gloved hands. If you suspect soil. But for your protection, get into the habit of rolling it away from you, all right? Unless you want to go home with something. And that's on you. Again, this is a good time for me to assess the pillow. If need be, I will wipe it down. If not necessary, I'll just keep it moving with my pillowcase. One other approach is they'll roll the pillowcase like so, and then put it over. Some people do this little hand thing. Just put the thing on, okay? Just put it on the best way you can. You want to try, if you're doing this with the patient in the room, what you want to try to avoid is like doing this over the patient's bed, because that lint that you can't really see is going to be flying all over the patient, and it does risk compromising or jeopardizing the health of the patient. So what you can do to avoid that is simply slide it up. And again, if we have some of the old school nurses, they want to see something like this. But if you're in certain units like ER, just look. Can we find a pillow 1 and is it clean 2? That's it. All right. So that's that. I'll just try to straighten this. That, and then boom, bam. All right. And some people be all picky too about what side you put this open pillowcase. So that's serious. Well, we will make sure that it is safety. You do not leave the bed up, okay? Always leave the bed down in its lowest locked position. Put the bed down. All right? And then you always want to make sure the car bell is within reach, so when the patient comes back from wherever they came from, you have easy access to it. And then that's it.